Good afternoon. I am Leandris Liburd, Chief Health Equity Officer for the CDC response in the COVID-19 Incident Management Structure. And I am also Director of the Office of Minority Health and Health Equity at CDC. Like me, I know you've been impressed and encouraged this afternoon by all of the important work happening in communities throughout the country. Each leader and organization we've heard from today are vital partners in the fight to keep our communities safe. CDC continues to work hard to address increasing COVID-19 health disparities and to achieve health equity, which we define as when everyone has the opportunity to be as healthy as possible. This is accomplished when we value everyone equally. As we continue to learn more about the impact of COVID-19 on the health of different populations, immediate action is critical to reduce growing COVID-19 disparities among the populations known to be at disproportionate risk. CDC's guiding principles are to reduce health disparities, use data-driven approaches, to foster meaningful engagement with community institutions and diverse leaders, to lead culturally responsive outreach and reduce stigma, including stigma associated with race and ethnicity. We have 4 strategic priorities to reduce the disproportionate burden of COVID-19. CDC intends to continue to partner with physicians, epidemiologists, researchers, public health practitioners, and state and local health department officials to implement CDC's COVID-19 health equity strategy. In the coming months, we will strive to expand the evidence base to increase our understanding of the impact and the factors that led to the disproportionate burden of COVID-19. We will expand testing, contact tracing, isolation options, and care, reaching populations that have been put at increased risk. And we will expand intervention activities to support essential and frontline workers to prevent transmission of COVID-19. And we will increase an inclusive workforce equipped to assess and address the unique needs of an increasingly diverse population. We all have a part in helping to prevent the spread of COVID-19 and promote fair access to health. To do this, we have to work together to ensure that people have resources to maintain and manage their physical and mental health, including having easy access to information, affordable testing, and medical care. We also need programs and practices that fit the communities where people live, learn, work, play, and worship. So at this time, I am delighted to introduce Vice Admiral Jerome Adams, Surgeon General of the United States, and one of the key leaders addressing COVID-19 disparities, and a tireless leader in advocating for health equity in all of our communities. Welcome, Surgeon General Adams.
I want to thank Rear Admiral Collins and the Office of Minority Health for providing me with the opportunity to address you during today's virtual symposium. I especially want to thank each of you for your efforts to prepare for and protect your communities against the COVID-19 pandemic. Today's symposium touched on so many important facets important to the health and well-being of racial and ethnic minority communities. These range from a deep dive into the data we have and the data we need, state, local, territorial, and tribal perspectives and recommendations, community-centered solutions, cultural appropriateness and language access, and the critical importance of engaging community leaders. Together, we can take the information covered in today's symposium to improve the health, resilience, and prosperity of our communities recovering from COVID-19. As the Surgeon General, I often tell folks that I'm a megaphone for the U.S. Department of Health and Human Services. I aim to translate and clearly communicate the data, recommendations, and most of all, actions that will lead to healthy behaviors and a healthier nation. Today, I'm asking you all to do the same. Be the megaphone in your communities. Take these best practices and recommendations and share them with your friends and colleagues. It is by working together that we can accelerate the pace of progress, the progress we all seek, and take big strides forward as a country. It goes without saying that these are truly unprecedented times. This pandemic has hit us hard, especially people of color and those who are older. And as you all know, the reasons are many and are rooted in both social and medical pre-existing conditions that conspire to reduce our resilience, opportunity, and our health. When we speak of COVID-19, we usually talk about health care. But while health care is critical, we know that health actually begins at home, in communities that are designed to provide income and financial security, education, and access to transportation. Communities that nurture health have safe places to be active and healthy, access to healthy, affordable food and housing, and are free of structural and institutional barriers related to race and bias. We know these social determinants contribute to medical determinants, chronic diseases such as diabetes, cardiovascular disease, and hypertension. These diseases are especially common in people of color. These conditions make individuals more susceptible to infection with COVID-19, and they are associated with more severe complications and death. In fact, American Indians and Alaska Natives and African Americans have been hospitalized at rates 3.5 times higher than whites. Hospitalization rates are 3 times higher for Hispanics compared to whites. We know some of the reasons for these disparate outcomes. For instance, social distancing and teleworking are critical to preventing spread of coronavirus, yet only 1 in 5 African Americans and 1 in 6 Hispanic Americans has a job that allows them to work from home. We know people of color are more likely to live in densely packed urban areas and in multi-generational homes. They're also more likely to use public transportation. Combined, these and other factors create a greater risk for spread of a highly contagious disease like COVID-19. Simply put, this virus is exploiting and exacerbating pre-existing health disparities. Although we've seen remarkable progress from New York City to more recently Arizona, we know there are new hotspots in too many places across the country. We've deployed teams to assist in surge testing and to identify and execute strategies to combat that spread. And the good news is that we are making progress in the structures, processes, and knowledge needed to fight the pandemic. As I speak with you today, more than 85 million tests have been completed. The national percent positive for the past 7 days is at 5.2%. In the past 7 days, 94% of commercial lab tests were completed within 3 days, and 98% were completed within 5 days. HHS has recently allocated about $15 billion to Medicaid providers and $10 billion to safety net hospitals, which are sources of care for our most vulnerable. And we've also invested critical resources in community health centers, ensuring that 28 million people living in medically underserved areas have access to the care and the testing they need. Beyond the testing work I mentioned, CDC now requires that all testing data reported by states include information on race, ethnicity, and zip code. This will allow us to better understand how to protect our most vulnerable communities. HHS has supported language assistance for those with limited English proficiency. For example, COVID-19 materials are now available in Spanish. In addition, the Office of Civil Rights recently issued a bulletin on ensuring the rights of persons with limited English proficiency in healthcare settings. Additionally, I want to applaud the Office of Minority Health for recently funding the National Infrastructure for Mitigating the Impact of COVID-19 within racial and ethnic minority communities. This funding directly supports dissemination of information and linkages to care for racial and ethnic minority populations. The administration's emphasis on public-private partnerships is further allowing us to progress toward vaccine therapeutics and diagnostics at a record pace as part of Operation Warp Speed. During normal times, Drug development involves a series of sequential steps. Operation Warp Speed is unique in taking some of these steps simultaneously in order to accelerate production of the vaccines that are found in clinical trials to be beneficial and safe. We all know that having a vaccine available is important, but is only the first step. Ensuring that all Americans have an equitable opportunity to receive the vaccine and combating vaccine hesitancy are key to ensuring the protection of all Americans against COVID-19. So please continue your conversations with friends, family, and constituents about why vaccines are important, whether it's for measles, flu, or COVID-19. In closing, I want you all to know that we are in a different place now than we were back in February and March. I've recently traveled to Texas, Georgia, Florida, and Hawaii, and I've witnessed firsthand that hotspots can turn around. Many of these states have proven it in just 3 to 4 weeks. How? By utilizing our best immediate defense against COVID-19, those tried and true public health best practices, which I call the 3 W's. My first W is wash your hands. My second W is wear a mask. And my third W is watch your distance, meaning keep at least 6 feet of distance between you and others at all times. While this pandemic has been an unprecedented challenge and we are still discovering what this novel virus is and does, it's important to note we've learned a lot in the last 8 months. We know who is most at risk and why. We know much more about how to treat those most severely affected. We know that we must address the underlying drivers of disparate outcomes, those social conditions that can either limit or unleash a healthy future. We know what works to keep people in their communities safe and have launched a messaging campaign called #COVIDStopsWithMe, because it does. We all have a role to play in preventing the spread of this virus. So I ask that you visit my Twitter account @Surgeon_General to watch my video and share it with your friends, colleagues, and loved ones. The fact is, I need your help in spreading the word that our health, our nation's future, is in our hands. Despite the challenges that we face, I remain steadfast in my resolve to use our scars, losses, and lessons learned during COVID-19 as a once-in-a-lifetime opportunity to make our nation healthier, more resilient, and more just. So I ask that you join me in getting the word out to people about how they can stay safe and helping them understand the progress we've made in the fight against this epidemic, because together we will get through this.
Thank you everyone for joining us today for these closing remarks. I will now pass things off to Roslyn Holliday Moore. Thank you.
Good afternoon. I am Roslyn Holliday Moore, the Deputy Director for Programs at the Office of Minority Health. I have the honor of closing our virtual symposium by thanking Surgeon General Jerome Adams, Dr. Leandris Liburd, and all of our speakers and presenters today. I also want to thank you, each of you, for joining what has been a very impactful and informative discussion. We have had the wonderful privilege of presenting important information that is happening in communities across the country. In the coming days, this event will be available on the Office of Minority Health's website. We ask that you help share the information highlighted by offering it to groups, leaders, and organizations who cross your paths, and assist them with broadening the knowledge and capacity to promote health equity in all communities. One last note. I also invite each of you to join the Office of Minority Health's learning community around COVID-19. This will be an important opportunity to continue networking and engaging in peer-to-peer information exchanges on ways to address COVID-19 among racial and ethnic minority communities. You'll find the link to join the learning community in the virtual resource hall, which will be open through 6 p.m. today. Again, thank you for attending today's virtual symposium. And on behalf of all of us at the Office of Minority Health, remember, as we work to keep our community safe, that it's also important that we take care of ourselves. Be safe, stay in touch, and enjoy the rest of your day. Take care.